So on the front page we've got some bump about what the quality standards are, so anybody coming new to this will understand the context and where they actually fit in. Then from there, across the bottom of the screen you'll see quick links and add title, add statement. So from there the users can actually see, top level if you like, what actual data they've got in the system. Then we move on to title. So we obviously haven't got the CKD one in here, but that one has actually been added now. So as the different standards come into being, this is where all the information is actually stored. So me as super user, that's one of my jobs. When we start getting all of this tranche of quality standards out, it's me who actually copies and pastes all of the information from the NICE site into this web tool. So it shows you the title, it shows you all of the statements, it shows you the detail behind that. And if you do need to see the detail, if you're going to click on the little eye icon, I think I've got an example here, yeah. So that's exactly the information that NICE put onto their website. So people can start seeing the context, the key document sources, the scope and everything else that they would be able to see on the NICE site. And below that, obviously I can't scroll down to show you, but this is where it starts listing the statements as well. But what we're saying to people, if you're the trust admin lead, it's up to you within your organisation then to decide which of these statements are actually applicable to your organisation. As a commissioner, we can't say, right, you've got to do this, this, this and this. It's totally up to them to agree. So where they think a statement is not applicable, then they can actually put that on this system. So it negates that, them having to report on that particular statement. So you'll see we've got a number of functions across there. We've actually got statements in there, any associated guidance, but we've also got count of actions. So as well, I'll show you a bit more about the actions. But then the different trusts can start building up a number of actions for each of the statements, so it starts giving them a better picture of where they are. Again, the detail icon just gives them exactly the same information that is on the NICE site, but from here they can start adding actions. So it might be that they've got a new policy that's been put in place, a new training strategy and things like that, so they can start listing the different actions and things that they need to think about and need to do. If you click in that add action or edit status, that's where they start actually building up this brag rating, so they can say whether it's applicable or whether they're actually compliant with it. You see as well, I mean, we're in actions now, but you'll see we can actually, because I'm a super user, it's going to get quite humongous really, the amount of statements and standards that we've got in there. So we can actually do a search on here by title or statement, or search for particular text, so it sort of makes it easier to navigate as well. But certainly in terms of actions, you can see we've actually started to get some information in here now. And like I say, it's totally up to that trust to decide whereabouts they feel they are, depending once again on the evidence that they've got to support what they're saying. And just see the icons at the end there, add note and add evidence, that's where they can start building up their pictures. So it's very much up to them what information they put in there. And again, you can see this is a breakdown. So if they were starting to add an action for the stroke, one of the stroke statements, it's statement 1. They'll select from their trust, but it's automated. Because I'm a super user, I can click in and put different trusts in there. But obviously it'll be already have their trust in there. So just in terms of further information, obviously all the details and information related to this are on the NICE site anyway. But the detail in the outcomes framework, you know, that's if you want to have a look at it and just to see how the statements actually link into all of those domains and how it actually works. So they're my contact details in case anybody wants to have a look at it or you need any technical information or advice about this database. We've got our IT whiz back at NHS Sheffield who'll be able to help you. But if you've got any questions on that or any thoughts, or if you think we're way off the mark, or if you think it'd be helpful.
Thanks for that. Does it take very long for the users to learn how to use the system or do you train them?
We've had training sessions built in, so we've always had our IT person on board, and we had a session. We went through all the different parts and elements as we were developing it. But obviously, I think it's quite intuitive really. Once you get into it and looking at your own data and populating it, it's like anything else, you know, it should become more intuitive and people should be able to use it. We have got a user's guide that's available as well, and obviously I'm not sure how helpful that might be to the user because it's written from our IT person's perspective, but you know, we'll go with flow and see how we sort of manage with that, and if we need to amend it or update it for our users, then you know, we'll do that. Okay.
Bev, thanks very much. Nobody uses this, I don't need it. Thanks very much, Bev, for that, and Martin, thank you as well. Oh,
I've got another one.
sorry.
If you want me to, I mean, we sort of alluded to this morning, so if this is, again, is work that we're doing in Sheffield, so if you want to learn more about the sequins and the proms. So the sequin scheme is Commissioning for Quality and Innovation, and that's what it's called. So I'll give you some background information about it, show you the elements of the scheme as it stands at the moment, and some reporting that we actually do in Sheffield as well, just to give you an overview really of what we're actually doing. In terms of the background, it was introduced as a concept in April 2009 in the operating framework, and this is applicable to acute providers on the NHS standard contract. So anybody who falls out of that, obviously it doesn't apply to them. It's only applicable to services financed by the NHS in England, and it shouldn't duplicate existing commitments. For example, the vital signs framework, looking at cancer or choose and book and certain things like that, because obviously they're sort of financed through other things. This is purely to think about how we're going to commission quality and innovation in services. Goals should reflect local improvement priorities as well as priorities outlined in the operating framework. And because this was new to people last year, the first year was very much about establishing the baselines. And then subsequent years we put further stretch on that, which we're starting to do now with some of these schemes as well. And that hopefully should lead to continued improvement. They can be used to implement the nice quality standards and drive improvement against outcomes, e.g. the PROMS programme, which I'm going to speak to you about in a moment. But we've decided not to do that in Sheffield. We've decided to keep those as separate entities. So the aim of the sequence is to put quality at the heart of board level discussions, which obviously that doesn't happen in all trusts all of the time, but this is just to try and help to innovate that and initiate discussions on quality. In terms of the scheme itself, there should be one scheme per provider. So where you've got an acute trust who's got multiple contracts or multiple commissioners, there can only ever be one scheme, and that scheme has then got to be agreed. It's a locally agreed package of quality improvement goals and indicators. So together these make up a scheme that you're going to be looking at and commissioning for quality, to incentivise quality. And it just shows you how much it's come on really, because in the first year they put 0.5% of the contract value onto the sequence scheme. For this year, it's just ending, it's 1.5%. So it's for our acute trust, that is quite a major amount of money. So it's extra money that they can earn on top of the contract money that's arranged with them. So it's a good incentive for them to actually take this sequence scheme on and actually address quality. And the scheme should address 3 domains of quality: the safety, effectiveness and patient experience, as outlined by Darcy. So it's made up of certain things then. The sequin goal, this describes a quality improvement objective which is being incentivised through a sequin scheme. So this can be described at a national, a regional and a local level. But that's the overall objective. We've then got an indicator, and that's the measure that determines whether a goal or an element of the goal has been achieved as a basis for payment. So that's where it starts to building in what the trust should actually achieve. And then we've got the biggie, it's a payment threshold. So they've got to agree on a payment threshold for each indicator. It should be informed by available evidence, and again we were saying about commissioning for using evidence that we've got available. Again, this is building into that and provide its own baselines, so we know it's got to be something that's achievable. An agreement can also be reached for partial payments or achieving in-year milestones. So if these are new to a trust and they're struggling to achieve particular indicators, then they could potentially get payment, a partial payment, if they don't achieve the whole amount. So an example of this would be, for example, to improve the health of babies and mothers in the 14 days after birth. That's your overall goal for the indicator. The detail within that is the rate of emergency admissions or readmissions to hospital of a baby within 14 days of being born per 100,000 live births. So again, you're getting into the detail and nitty-gritty of what you're actually looking at and what you want to home in on. And the payment threshold then will be fewer than 8 emergency admissions per 1,000 live births. So if they didn't meet that target, they wouldn't get payment unless it had been agreed that they get a partial payment. So that's how the system sort of breaks down and how you start linking your payment into actually achieving that indicator. It was optional that we actually shared the schemes that were developed or have been developed in previous years, but now I think it's going to be more, not of a mandate, but a requirement really that we share what we're actually doing so other areas can learn from the schemes, from the targets and indicators that have been developed, because obviously it can be quite difficult when you're starting from scratch. But that's the website anyway, if anybody would like to have a look on the NHS Institute website. In terms of the programme this year, we've had 2 national ones, which have obviously been applicable to our acute provider, but none of the others. Looking at VT prevention, which is data that's collected via the Unify system, and also improving responsiveness to personal needs of patients. So again, it's building on the patient experience indicators and looking at 5 things in particular where there was large variation to try and bring some sort of improving services around personal needs and improving that across the board really. And what we've done in Sheffield with our acute trust is actually build more local ones into that as well. So they're looking at not only reporting at the end of the Q4, but they've been reporting on a regular basis to look at these particular indicators within that to make sure that they can monitor their own progress as well. The regional ones have been agreed by providers and commissioners across Yorkshire and Humber, so that was done very much in conjunction with each other and right across the board. And then local ones, they're determined and agreed locally for Sheffield between commissioners and providers, but again it's optional whether you actually agree and decide on these at local level. Obviously if it's going to incentivise payment and quality, then it's been quite successful for us in Sheffield certainly. So just to break down in terms of how we're reporting on these, and what's actually available at the moment. Our acute trust has got 2 national, 6 regional and 7 local. You can read those figures for yourself. The children's have only got 7 local because obviously the national ones aren't applicable to them, and the regional ones, when we looked at the detail, it wasn't going to give us anything that they could actually work to. So instead they developed only a local scheme to incentivise their quality. There is a national template being used now to report the sequence at high level, so it includes all the detail within that. And also in terms of our reporting to the SHA, they developed sort of web sheets, if you like, that were building on all the indicators, so we could actually add our detail in there for it. It's just like numbers basically. So we collect all that, but what we did, we duplicated that template as well locally, so providers were using a similar sort of thing to report their results. We've got provider reporting again into the clinical quality review groups as per a national contract requirement, so it is a requirement that they report back through that route. We've also got internal reporting at NHS Sheffield by our contract steering group, so this is where it makes it official. We've got to check and monitor progress, that the providers are making progress as they should be, and any impact that it's going to have certainly on our monies that are available and our commissioning if we feel they aren't going to achieve that particular indicator.